COVID pandemic has come in and changed our lives in such a short amount of time. I'm just surprised at the impact that one virus can have. Um, when this first came out, honestly, I thought it was like a bad cold, and only people who were 70 and older with some coexisting medical conditions would really be affected. And in a short amount of time, we realized there was a lot we did not know about this disease, and we're still learning. And that's the scary part, the unknown. When is this going to be over? If you get the disease, how do you know if you're going to have the mild symptoms, or you're going to be like some of these people who are young and healthy and are dying from this disease? How long are you going to be immune from it? I mean, it's just so much that we're learning. And what I will say is it's scary. Being on the front lines, I'm currently working in a fever and cough clinic, so I'm seeing patients come in with COVID. I am also helping out with the COVID convalescent plasma study and hearing the stories of people who have recovered, and everything from very mild to asymptomatic and lost their taste or smell to in the hospital with pneumonia in both of their lungs on a ventilator. And it's not always, like I said earlier, the people that you expect. And it's scary on many factors. At being a nurse practitioner and being here in this center, of course I'm scared to get COVID. I live by myself. Who's going to take care of me if I'm sick? I can't have my mother. I don't want anybody around me who's also going to get sick. So that's the fear. But I will say what motivates me to be here and to come here on a weekly basis because I'm a nurse. I am a nurse practitioner. I chose this profession for a reason. I chose it because I want to help and make an impact in people's lives. And as cliche as that sounds, I think a lot of the healthcare providers, people on the front lines, we put that fear aside and really think about the good that we're doing, and knowing that we have this talent, this skill, this education, this background that we could go out and help people survive, help people, with preventing this, spreading the word, educating. And we're choosing to do that because that's the profession that we chose. I have been around through 9/11. I was working in New York at a hospital during that time, and I could tell you nothing compares to what is happening now. It's affecting everyone around me. I know people have lost their mother, people who have had COVID, people, who are right now in the hospital on a ventilator, not knowing if they're going to make it or not. It's scary. But what I will know, there are some beautiful things that have come out of this, and I can tell you, working in the hospital, I have had the opportunity to work with the nurse educators from New York-Presbyterian and putting together educational programs so that we can train our nursing students to be nurse technicians and work on the front line. That we're putting programs together for residents so they can be on the floors and helping with drawing blood and doing certain clinical skills that'll definitely take the burden off of the nurses. To taking nurses who have been working in an operating room setting and now, being redeployed to work on a medical surgical floor and work with patients with COVID. So in times of need, we know how to step up. We know how to collaborate, to work together in a short amount of time and do what's best to get the job done, which is taking care of these patients. The hope, what I wish, 5 weeks from now, 6 weeks from now, I would have known. Being that I'm in the simulation field, that's what we do. We practice these situations over and over again so that when they do happen, we'll be better prepared. And boy, do I wish there was a simulation for this. We practice disaster simulations. It's just not the same, and I don't think we ever could have been prepared for what happened. But the hope is moving forward. We go back once this is all said and done and look back to see what could we have done differently. What are those amazing things that we did? And how do we create a policy, guidelines, protocol, in the future so that if this ever happens again, and I wish it doesn't, that we'll be better prepared and we won't lose as many lives, and we'll be able to, make sure we have the amount of beds that we need and the equipment that we need. So just taking the lessons learned and making sure that we're in a better place if this ever happens again.